When news about the Vice President of Nigeria, Yemi Osinbajo, needing surgery for a long-standing injury made headlines, some Nigerians will have thought he will head abroad for treatment. Instead, the Vice President chose to undergo the surgical procedure on his right femur at Duchess International Hospital, a local hospital here in Nigeria. The Vice President was clear that he had confidence in Nigerian doctors both at home and abroad, and would prefer they handled the operation. The question now is, will this show of confidence in our local healthcare system by the President influence the political class that constantly engages in medical tourism to utilize facilities at home rather than going abroad for health emergencies? Joining us on this show this morning, right now, to give us an update on Vice President Yemi Osinbajo's condition following his surgery over the weekend, and also the medical infrastructure available in Nigeria and the efforts made to curb medical tourism, is Dr. Tokunbo Shitta-Bey, Chief Executive Officer of Duchess International, and Dr. Adedoyin Dosunmu Ogunbi. Welcome to the morning show, gentlemen. Thank you very much for joining us.
Thank you. Good morning.
Well, let me start with you, Dr. Shitta-Bey, just to give us an update on the procedure that the Vice President underwent. We're told in the reports that this was a case of knee surgery and that the surgical procedure was successful, but we'll just be interested in the update. And, you know, the sentiments that have been expressed about his choice of a local hospital. How significant is that?
Okay, well, thank you very much. Thank you very much for asking that question. I think the first thing that we would like to say is that this is a hugely significant responsibility that we have at the Duchess International Hospital, and we do not take it lightly. Of course, together with the rest of the nation, our thoughts and our prayers are with the Vice President and with his family at this point in time. To speak directly to the question you're asking, the Vice President is making good and steady progress, and we expect that that things will continue to proceed in that direction. Yes, he did sustain a fracture to his thigh bone, and he's had very successful surgery, and we expect that he will continue to make satisfactory progress, and we hope that he will be discharged at some point soon.
Well, Dr. Ogunbi, you want to add to that?
Thank you very much. Again, thank you very much for having us. It is a great privilege, and I think as a people, I think we need to be very grateful that our Vice President has chosen to have his care done right here in the hospital in Nigeria. We are building capacity in this country, and I think Nigerians need to know that there is capacity to do a lot of sophisticated procedures right here, and the Vice President has demonstrated this, and this really is leadership in action. So this was a stress fracture, as we say, meaning that it's a relatively very subtle compared to a frank, open, and more obvious break. So a subtle fracture is like, or some people may say hairline fracture, and so relatively subtle in its appearance, but it would still be very painful. So with all of the Vice President's duties and all the campaigning that he's done recently, all that was done in significant pain. So that's why the procedure was necessary. And again, as our CEO has said, he's making steady improvement and recovery from the operation.
And we're so glad to hear that. So I'm going to start with you, Dr. Shitta-Bey. Much has been made of the political optics of the Vice President choosing a Nigerian hospital, not necessarily Nigerian doctors, because people fly abroad to see Nigerian doctors, but he chose to stay here at home. But beyond that, I don't see a man like the Vice President putting his agility, his health, or even his life on the line if you agree that there's no such thing as a minor surgery, if he actually did not trust Duchess International Hospital. So can you tell us why he chose you? What are the facilities that you have, and why that he was confident in that choice? And also, there's also the perception in the midst of all of this that Duchess International Hospital, I mean, your facility is really grand. It's, you know, out of the reach of most of the Nigerian population, even though your brand mission is quality and affordable healthcare. So can you just take us through all of that?
Oh yes, of course. I would first. Of course, I would first begin by challenging the perception that the service is an expensive service out of the reach of most Nigerians. The fact is, it's not. And this is part of what has informed the Vice President's choice to select the Duchess International Hospital as his preferred hospital for having his care here. We at the Duchess speak in terms of what we call access to affordable world-class healthcare. And what that means really is that we have given a lot of thought into the very highly emotive subject of access and taken deliberate steps to bring down the barriers, those obstacles that prevent people accessing those essential services. So I'll take, for example, to register at the Duchess International Hospital and to see a doctor is no more than 5,000 naira. And that is the first and most important statement that I felt that we needed to make. The service also offers a wide and extensive range of essential services. So that's another very important point. We have a consultant-led service at the Duchess International Hospital. It's very important that the decisions that are made within the first few minutes are precise decisions. So you're far more likely to see a specialist consultant within the first 10 minutes of being in the hospital at the Duchess than perhaps any other hospital in Lagos. Of course, all of that contributes to the safety and the security that patients have when they come in. It's also really, really important to us that the entire community is able to access the service. So apart from the fact that we are priced to ensure that we are no more expensive than any other hospital in our vicinity, we place a deliberate emphasis on 24/7 access to emergency care and critical care services. The complete range of services that we offer is from pediatrics, children, to elderly medicine, and that includes maternal and child health, lots of specialties and subspecialties within our practice. And we also offer this environment that allows Nigerians in the diaspora to come back. So yes, we are focused on reversing medical tourism, but we're also focused on bringing our boys and girls back home to practice here. So all of this really contributes to a safe and secure environment that would enable people to come and have the care that they need. And I think this is largely what has informed the Vice President's decision to have his procedure at the Duchess International Hospital. I would go further to say, of course, that the concept of reversing medical tourism is very much talked about. But in real terms, there's about 600 billion naira that's hemorrhaging these shores every year. Just some simple arithmetic says, well, that's perhaps about 60,000 Nigerians on average spending about $20,000 a pop. It's really important to have the range of services that will keep that money, keep that expertise within this country. And that precisely is what the Duchess International Hospital represents. I would go further to say, actually, that we need not one Duchess hospital. In this country needs about 50 Duchess hospitals. So the things that are really important to providing that access, bringing down the cost of healthcare, access to registration and essential services, having the breadth of services available, having specialists front-end the service, having 24-hour emergency critical care to build a service upon, and having the right governance arrangements, both clinically and administratively. Those are all of the things that contribute to a robust environment. And I think that is the confidence that the Vice President has displayed in the service and that service is available to all at this point.
Dr. Ogunbi, do you have anything to add to that with regards to why you were chosen in spite of all the options available to the Vice President?
I'll really echo what the CEO of Duchess International has said, that we do have a number of good hospitals in Nigeria now, but I think the fact that the Duchess is also trying to be accessible to as many Nigerians as possible, I think also attracted the Vice President's attention. And obviously the fact that quality healthcare is available in the hospital obviously informed his decision as well.
So I'd like to know more about what really happened to the Vice President, because the public citizen and the post-op, can he get up and go now, or is he in physiotherapy? What is really going on? Just some details, how long did the surgery last? I mean, like we see in other climes, when the president goes to water read or something, we're getting by-the-minute detail and advanced information, what's going on, even some of the procedures being used, Yes. Yeah, can we get some of that?
Yes, and I hear you, as they say in the US, and let me very, very quickly presage that by saying that I came back from the US. Our CEO has talked about bringing our boys and girls back home, and so I'm part of this. I'm not the only one, and I know what you're talking about. They give them blow by blow details in the US, maybe too much, but in any case, yes, the public is entitled to know what's going on with their leaders, in my opinion. And so here we are. So to answer your question, the procedure occurred late Saturday afternoon. It was about a 1-hour operation, and we've already said that this is a so-called stress or hairline fracture in the right femur. The femur is the thigh bone, so the big bone, of course, under your thigh. And so it was there on the side of the femur. And the operation was about 1 hour, carried out by 3 orthopedic surgeons altogether, obviously with a lead and two assistant surgeons, orthopedic surgeons. And again, a 1-hour procedure, and then the recovery was about 2 hours. When I say recovery, he was in our recovery room for 2 hours before being brought up to his room, and it went smoothly, all according to expectation. There was only minimal blood loss, just what you would expect. He remained stable throughout, and I was able to evaluate him before the operation and afterwards, and he's doing well. Physiotherapy started the next day. It would have been the same day, but by the time he came out from recovery, it was already nighttime, really. So for that, normally you'd start the same day. For that reason, it started the next morning. And I can tell you that physiotherapy originally started with him in bed, which would be normal, at least for the first few hours. But by yesterday, I can report, right in my presence, he walked. So he's walking already, taking a few steps. You can imagine after major surgery on his right femur bone, that is really very encouraging. And he continues to recover. He has a strong constitution. And as we would say, I'll just say he has a strong constitution, and he is very, what we would say, compliant or very. He follows the doctor's advice. Yeah. I didn't want to use, or you can say orders, very, very diligently. He's an excellent patient.
Oh, good. You want to say something about that?
Yes, of course. Yes, of course. I mean, it's interesting thinking about the Vice President following orders. He's, I would say, yes. The concept of ordering around the Vice President is, he is a model patient, and I think we have been able to observe at close quarters the very essence of the man. And it comes through in the kind of patient that he is. Very compliant, listens to advice, And as such, he's making the sort of progress that one would expect that a patient, any patient who is compliant, would be making at this stage. So as the medical director has said, he's now undergoing physiotherapy, so that's part of his rehabilitation, hopefully back into his own home environment. And the multidisciplinary team that has been involved with his care have been very, very pleased indeed with the progress that he is making for precisely that reason. So yes.
Okay. Very quickly, I'd like to ask both of you. Everyone has been saying, oh, this is very good that the vice president has chosen to be treated in Nigeria. But then, you see, we must underscore the fact that he went to a top-grade private hospital. And there are many of such hospitals in Nigeria at the moment. Reddington, Duchess, even in Abuja, they have quite a number. People returning from abroad to come and invest in the medical sector in Nigeria. Would the vice president have been able to get the same quality of care if he were to go to a public hospital, for example, in Nigeria? Because we have, Nigerian doctors are very competent and all of that. We have the best of the best in Nigeria. But what do you think is wrong? That there's this gap between the public hospitals and the privately owned hospitals. Would he have gone to a hospital in Okokomaiko, for example? Okokomaiko General Hospital, for example.
So,
yes, let's start with Dr. Shitta-Bey.
You say Okokomaiko General Hospital very deliberately in a particular tone of voice. I would like to begin by acknowledging the tremendous work that our colleagues up and down the country do in providing decent health care in quite Spartan circumstances, actually. Colleagues have become quite good at making the most of the scarce resources that they have. I think really it's about building a system. In a world in which only about 50% of people all over the world have access to an MRI scan, we in this country seem to be on an upward trajectory in terms of infrastructure and equipment. However, of course, there is the massive problem of brain drain. I know that there was an article in the Lancet as far back as 10, 15 years ago that said there were more practicing doctors in the US than there are in this country. So that is going to be a very, very important factor in, in encouraging people to come back to practice. I said earlier that we need not one, but 50 Duchess hospitals. So it's about the investment in healthcare, making sure that the facilities that we have in this country at primary, secondary, and tertiary care level are in that collaborative space and able to work together. It's about building a system. On the question of whether or not the vice president may have elected to go to a hospital in Okokomaiko, I think the first thing that I would say is, of course, his health is a matter of a great public interest, but he still is a private individual and he has a choice. I cannot, of course, speak for the hospital in Okokomaiko, but I do know that there are many other hospitals, quite like the Duchess, doing very, very good work. And our focus is on working together with hospitals like this to provide good access to affordable health care, just like we are doing at the Duchess Hospital.
Dr. Gumbi?
So again, I would echo what has been said. The first thing, as you asked in the question, the first thing that came to my head, I remember when it was 1980s, I think it was, Mrs. Thatcher, if I remember correctly, was admitted to a hospital in Britain, a private hospital, and as you can imagine, that was controversial. She could have gone to a public hospital. So I guess I say that to say that, well, it's not just in Nigeria where leaders are treated in private hospitals. I think it would, in those places, it really would be a scandal if they had gone to another country. That we just to leave that there. But Yes, and again, as our CEO, Dr. Shitta-Bey has said, there are a number of good hospitals in Nigeria now. Now, it is obviously a reality that resources are rather scarce. It is a fact that in Nigeria the healthcare sector is relatively under-resourced, and that's simply a fact. If we look at a country like Britain, spends about 122 billion pounds every year on their national health system. We're not expecting Nigeria to spend that much, but it just gives you an idea of what it takes to have a high quality public system. So that's a conversation that we would need to have as Nigerians if we want to have high quality healthcare for everybody. I would argue or point out that by Western standards, the entire healthcare sector is part, and not just the public general hospitals. We all have to, work with relatively limited resources. Even in the fancier hospitals in Nigeria. So this speaks to the amount of money that, as a society, we've decided to dedicate to healthcare, or the lack of it.
Well, we'll also need to prepare to pay higher taxes like they do in the UK, because the NHS is funded by taxes. Now, with regards to medical tourism, do you feel legislative intervention is needed? For example, this bill that just passed its second reading in the House of Representatives, trying to criminalize by a jail term of, I believe, 7 years and/or a hefty fine public officials who use public funds on foreign medical trips. A similar bill had passed the same stage, but eventually got thrown out because it breached fundamental human rights, or that was the argument at the time. Do you think that kind of intervention is necessary or advisable?
Well, of course, I'm not a politician, and my position doesn't directly involve policy, but as a private individual, I would say that, I think that in terms of the precise mechanism by which it's accomplished, perhaps it's not necessary to prescribe jail time, but I would agree with the premise and the goal. I think that all public officials, in my opinion, all public officials in Nigeria should, as much as possible, have their healthcare in Nigeria. If the healthcare need, the operation, if the treatment is available in Nigeria, then they should get it in Nigeria. If it's available, and in many cases it is available. Now, we don't have everything in Nigeria, and I think if we don't have it in Nigeria, then they can go out. But where we do have it, they should stay in Nigeria.
Dr. Shitta-Bey, your thoughts on criminalizing medical tourism on public funds?
Right. Okay. I won't restate. Okay. I won't restate the obvious. I completely agree with what Dr. Ogumbi has said. However, I will add, as an individual who's responsible for managing a hospital like the Duchess, I would add that we would rather focus on what our responsibility is, and the key issue is trust. What we have in this country right now is a crisis of trust. The real reasons that people are electing to seek healthcare abroad is because they do not trust the healthcare system in this country. So we need to focus on that and think very, very carefully about what trust means. And for us at the Duchess, it means strong clinical governance, strong administrative governance, having safety and security in the system, running a consultant-led service, being able to provide the breadth of safe care across a variety of specialties, from cradle to the elderly. Making sure that people feel that they are getting precisely the same level of treatment and safety as they would should they leave the shores of this country. So I would rather focus on what is our responsibility to do. And it is a collective responsibility that includes, of course, us at the Duchess Hospital, our colleagues in other hospitals in this country, Nigerians in diaspora, and of course, government. So I would stay away from the question of whether or not we ought to criminalize people, the practice of going abroad. I think what's far more important for us in the medical sphere is that we focus on the reason this is happening, and that key issue is trust.
Right. And I was excited when you talked about Margaret Thatcher going to a private hospital, back in the days, but also recently when Boris Johnson was fighting for his life from COVID, he went to an NHS hospital, St. Thomas Hospital, which is a proper NHS Trust hospital. But when you dial back, this wasn't the case in Nigeria before. In the 70s, University College Ibadan was rated the 5th best healthcare university teaching hospital in the Commonwealth. And then we used to have visits from the Saudi royal family and the likes to come get their healthcare there. You had all the prominent doctors. Every department had a great person. Even psychiatry department, where it wasn't prominent in the 70s for mental health issues, you had the likes of Dr. Adeoye Lambo, very towering figure and the likes. But today, it's a shadow of itself. Most of those doctors left in the 80s and they found themselves in other parts of the world. But how can we bridge the gap? And this goes to my question, really. Can we sort of use the Indian model, the Dr. Devi Shetty model, that democratized open heart surgery, made it very, very affordable, over 1,000 hospitals in the rural areas, that people can get this kind of healthcare you give to the barest minimum in society?
And again, that actually is our goal at Duchess, is to provide affordable healthcare to as many people as possible. And I know what Dr. Shetty was able to do. He was able to use the model of Henry Ford, as I understand, by being more efficient with your delivery. You can bring costs down. So that, of course, needs to be done. If you're efficient, you can bring costs down, and so you can, therefore, obviously, charge less. Now, to speak again, we go back to, if you're talking about being able to realistically expect our public officials to use public hospitals, we are talking about, again, it's a question of funding. That you need money, and that also explains what happened to UCH, Luth, and all of these hospitals. Yes, people used to fly back. My mother flew back from Canada to UCH to deliver me, and I'm not alone. I've heard that story over and over. People went to UCH for the deliveries. UCH had some of the best doctors in the world. He went on to have, I can think of Dr. Henry Lawson.
Adeoye Lambo, that served in the World Health Organization, yeah?
Yes, absolutely. Yes, Professor Lambo, and even there were British doctors there, Nigerian doctors. I mean, I'm not saying you have to be a British doctor to be a great, but I mean, the point being they had great doctors. It was one of the best hospitals in the world, probably comparable to Harvard, to Massachusetts General Hospital back then. Things have changed. Money is the single biggest reason. It really is. These things take a lot of funding. You look at a U.S. hospital, we're talking about $1 billion or more per hospital. I'm not saying that we need to spend $1 billion in each hospital here, but we need to do more. We need to do better. And clearly we have resources in this country, but it's a question of how we choose to deploy them. And obviously we do need to grow them. But I'm not an economist, but we need better resourcing.
All right, Dr. Shitta-Bey?
And that's absolutely correct. That's absolutely correct. It all boils down to the question of funding. So let's look at some of the numbers. The 100 billion pounds that Dr. Ogunbi just talked about, 10% of that is on diabetes care alone. Now, we know that there is an iceberg of risk in this country, that is cardiovascular disease. It's just waiting to erupt. Let's put that in context. Per capita spend on healthcare in a place like the US is about $11,000, $12,000. In Nigeria, it's about $70 US. So funding is the key issue. Now, the Duchess Hospital is as government as it gets in the public sector. Maybe that's part of what's contributing to the picture of success that we see. The hospital, of course, has had support from the Central Bank of Nigeria and the Bank of Industry. So we are not burdened by double-digit interest rates in foreign exchange. Another reason why we're able to pass those benefits on to the people and begin to speak of access to affordable healthcare. So even though it looks like a big, imposing building, our gate is open, and that's a metaphor to say that this is a hospital for the community. We are able to do this largely because of the funding support that we have received from the federal government. So just to underscore the fact that funding is really, really important. If you get the funding right and you get the governance right, you begin to have the start of what you can call a proper, robust healthcare system. And that's precisely the reason that Boris Johnson can end up having is been admitted to the ICU at St. Thomas's, because whether you're in the NHS or you're in the private sector, you can be assured of a properly funded healthcare system, and that is precisely what we need to achieve in this country.
Okay, well, quickly, let me pack 3 questions together. I recall that the Vice President commissioned the Duchess Hospital last year, October 2021. So is he your friend personally, beyond being Vice President, and could that have been a factor in his choice of the hospital? 2, how much is he paying for the surgery? I would like to have an idea in case I see somebody who also has a pain in the leg, so that I will have an idea of the cost. And then finally, I mean, beyond medicine, you are running a business. How are you coping with the high cost of diesel to keep the hospital going? Dr. Shitta-Bey.
Those questions would naturally be directed at me, wouldn't they? First of all, on the question of whether or not the Vice President is I believe you personalized that and said my friend. No, he is the Vice President of the Federal Republic of Nigeria. He is a national treasure, and it is an honor to have him in our hospital. Having said that, of course, he receives the same level of safe care that anyone who would come into the hospital would receive. Of course, the additional considerations for security, because this is a matter of national interest and security. Your second question was about how much he's paying. I'm sure, of course, that you wouldn't expect me to answer that question, regardless of who it is concerning, Vice President or not. It is the question of what a patient is paying is a very, very personal matter. But what I will say is that the cost of a repair surgery for the kind of condition that the Vice President has had is very, very affordable indeed. And I've gone to great lengths in this interview to explain why we can even begin to speak of access to affordable health care. We are not burdened by the kinds of loans that perhaps others would be burdened with. And the next question you asked was about, what was the other question? About diesel. Diesel is a perennial problem and a hugely significant issue that affects all of our lives, not just healthcare. How are we coping with it? Well, of course, it is contributing to the bottom line. It is a very lofty idea to have a service like the Duchess International Hospital positioned to do many great things. It does have to be underpinned by sustainable business. So yes, like every business, like every facility in this country, like anyone who's trying to do anything worthwhile in this country, the cost of diesel is a very, very significant consideration indeed. So the sooner we fix that problem, the better for all of us. But I think the central message here is that the Vice President is getting very good care, and he's making very significant progress indeed, diesel or not.
Thank you very much for joining us.
That is the bottom line.
Yes, well, I think that's about it. Thank you very much, Dr. Shitta-Bey and Dr. Ogunbi. Thank you very much.
Thank you very much.
Thank you.
Thank you. Thank you.